But let's talk about COVID-19 and that situation in the United States. Recorded cases have been rising in the country as the Delta variant continues to spread there. Data from Johns Hopkins University says the US now has recorded more than 40 million positive cases since the start of the pandemic. Today, we are focusing on the southeastern state of Florida, which is seeing its deadliest wave of the virus since the pandemic began. There have been reports of shortages of nurses and burnout amongst hospital staff. Well, I've been speaking to two nurses to get a view on what is happening on that front line. Dorothy is an ICU nurse and part of the Haitian American Nurses Association in Florida. And Marissa is a labour and delivery nurse and a board member of the National Nurses United, the country's largest nurses union. She's based in Florida too. Marissa spoke to me at the end of a night shift, so I asked her how that night shift was.
It was horrible. That's the nicest way to describe it. It's extremely busy, lots of patients, seriously ill patients. So it's very physically and mentally exhausting.
Well, night shifts are tough at the best of times. I imagine in the current circumstances with those growing numbers, it feels relentless.
Definitely.
And Dorothy, for you, you work in an ICU ward. And I want to put this quote from another doctor who said, here's the important thing. Everyone that I'm hospitalizing is not vaccinated. This is a disease of the unvaccinated right now. As someone on the front line, what are you seeing in your ICU ward?
Yes, unfortunately, and most patients that we see right now, they are younger and as well unvaccinated. And that's the one mostly they come, they have no medical history. And the next day, they are on BiPAP and they pull out the BiPAP, they end up intubated and they are in ICU. Most of them, they may expire. And unfortunately, unvaccinated, most of them.
Of course, and it's a familiar scene in so many hospitals, not just in the US, but around the world as well. I want you both to talk me through a typical day at the moment, because some people might say, we've heard this before. This was happening 6 months ago, 12 months ago, 18 months ago, but I want to understand how it's changed. So, Marissa, talk us through a normal night shift at the moment.
Well, okay, last night, I'm a labor and delivery nurse, so what we're seeing are young pregnant women between the age of 24 up to about 36 who are not vaccinated. They come into the hospital with mild symptoms. In fact, we have one that got admitted last night, this young lady, and unvaccinated, 24 weeks gestation, critically ill. In ICU. We had to transfer her to ICU. This young lady came in and took a turn for the worse in less than 6 hours. She was talking, speaking. The next thing we know, she has 102 fever. The next thing we know, she's unconscious and we're transferring her to ICU. Now, this young lady, is so severe that at this point, I honestly think this young lady will expire today.
And that, in turn, must take a huge emotional toll on you as well.
Not only emotional, physical, because we go into nursing to do the right thing. And what we're seeing is that our employer are not doing the right things for our patient. And I've been a nurse for now 36 years. So I came up through the era of HIV. And what I see now and what happened during the HIV era is so devastating right now, because I never had to fight for equipment. I never had to search and just, it's hard to nurse today. I'm going to tell you. I mean, last night for me was horrendous for this young lady. This young lady that senselessly is probably not going to recuperate from this.
Do you know what's striking hearing you say that? You are a nurse with an abundance of experience over the past 36 years, yet I can hear in your voice just how deeply this impacts you when you tell me what has happened to this young mother.
It's unfortunate that this young lady is never going to see her child. That's the way it is for her. Unfortunately, we can do something. People need to get vaccinated. People need to wear masks. Here in Florida, it's unbelievable how many people are walking around like it's an everyday thing, an occurrence. People are dying. Young people are dying. We don't need any young people to die. Please get vaccinated. Please wear a mask. Social distancing. If you don't want to take care of you, take care of me, because I'm immune suppressed. So if I get COVID, I'm going to die.
And I do want to talk about your personal circumstances in a moment, but Dorothy, let me bring you back in here. Your typical day on an ICU ward, which I can imagine on an ICU ward is largely bleak because you are dealing with the most poorly of people. What has it been like in recent weeks?
In recent weeks, it's detrimental because the difference in age, you see like younger patient, you see patient come intubated. And before, normally, the patient can come to the hospital, they sick, and they get better, and they discharge home. But however, with COVID, there are patients, that come in, they came walking with little oxygen support, and the next day, the patient's on high flow BiPAP, they pull out the BiPAP, then intubated, and most likely expire.
When you say pull up the BiPAP, what is that?
The BiPAP is the machine after the high flow, high oxygen. So this BiPAP, it's higher than the high flow. So he can give like 100% oxygen.
And just explain why you said some patients are pulling it out.
Because too much oxygen, and it make them thirsty, and they cannot breathe. They dragging for air, and too much pressure. They cannot handle it. So they pull it out. With the mask on, they pull it out. So,
and we're hearing from Marissa there just how under-resourced she feels right now. And she works on a labour and delivery ward. You in ICU, do you feel like you have enough resources, enough staff, enough nurses, doctors?
Staffing shortage is an issue. And long hours, you have to work long hours, and staffing issue. So it's a big problem. It's heartbreaking to see so many, people come and they don't get to go back home. And it's heartbreaking.
The employer's saying there's a nursing shortage. There isn't a nursing shortage. I'm going to be honest with you. The employer is not hiring their nurses out there. Nurses are leaving the field because, like Dorothy said, we're exhausted. You know what? Normally I work 3 shifts per week. This was my 4th shift tonight, and then we work 12-hour shift. And they're saying, well, that's a nursing shortage. No, the conditions that they put us in is what's causing nurses to leave the field, because we don't have the equipment, we're working long hours. The expectation is so high. And we nurses, we took an oath. But conditions have gotten so severe, whereas a good example is this past Saturday, one of the nurses on my floor had a COVID positive patient, symptomatic, and had a regular patient because there was not enough nurses to go around. Who do they say? Well, that's the nurses because there's a nursing shortage. There's not a nursing shortage.
And I should stress that you work actively with the US's largest nursing unions there as well, Marissa. So you've long been fighting for workers' rights there, a matter that is very close to your heart.
Yes, ma'am. Yes, ma'am. That is true. That is true. I'm tired. It's not easy working a 12-hour shift. Try working. Well, I worked 4 this week, and last week I worked 5 12-hour shifts because I felt that, I had this need to, help the patient, help my coworkers. My coworkers need help.
And so hearing you feeling so exasperated with the situation with your workplace, do you ever feel like quitting, or would you quit? I mean, you are, like you said, you've been in this industry for 36 years. I believe you're a woman in your 60s. No one
Yes,
would blame you if you said it's time to call it a day.
can't do that. Can't do that. First of all, I can't do that because I I was supposed to retire just before COVID hit. Then I saw it coming, and I said I cannot leave my coworkers, and I cannot leave my coworkers working short without nurses. I was supposed to retire a year ago. That was my goal, but I couldn't do it because my dedication to not only my coworkers but the patients. They're number one priority. I can't just quit and say, forget it and forget that patient. No, no, that's not what, I went to nursing school. I went to nursing school to make that patient's life easier.
Well, Marissa, we commend your commitment to your field. Dorothy, do you ever have feelings of wanting to leave nursing as a result of all that's happened over the past 18 months?
I love nursing, and I know we can get through this together if people practice what they're supposed to do. Hand hygiene, extremely important. Wear their face masks. Avoid large crowd. Even though you're vaccinated, wear your face mask and get vaccinated as soon as possible. We can get through this together.
Well,
Okay.
I can also hear the positivity in your voice as well there. And Marissa, you are a Black Hispanic woman, and Dorothy, as I understand it, you are of Haitian heritage. So both of you are from minority communities and communities that are more affected by COVID-19. How does that change things for you mentally, physically, in that thought process?
It gives me strength. Sometimes I get a little discouraged, but I have to have strength to educate the community, through health fairs and to help the community. We cannot back down. We have to educate them because if the community is educated, they will get vaccinated eventually.
So you're saying there's a reluctance from the Haitian community there in Florida to take up the vaccine?
Yeah, but with education, a lot of people they're going for the vaccine right now. A lot of people. There's a big increase for the vaccine.
And Marissa, what about you? You're not just a woman who falls into that minority category, but you also have pre-existing conditions, as you touched upon earlier. How does that take a toll on your well-being?
I can't think about getting sick because there are patients that need me in the hospital. So I don't put my condition or my possibility or my exposure to COVID as a priority. My priority are my patients and the nurses. And I totally agree with Dorothy. And that's why I chose to do this interview, because this interview is going to educate people on the need and educate them that the vaccine is not a cure-all. The vaccine, what it is, it keeps you from getting, the worst kind of COVID. You are putting our voices out there. And I hope a lot of people are listening to this and listening to us. We see those sick, ill, dying patients in the hospital. There is no need for anybody else to die. Please get vaccinated.
On a personal level, and very importantly, I do want to talk about support networks because, Marissa, I know you're very close to your adult daughters, and your job and this pandemic has really taken you away from them. How does that make you feel?
Well, my daughter said one thing, and at the beginning when the vaccinations came, I was leery about getting vaccinated because of my immune system. My daughter said a couple of words to me that struck well. She said, "Mommy, vaccinated and a little bit of side effects, or Mommy, not vaccinated and death." I got vaccinated. Vaccinated. And yes, it does take me away from my adult daughters because we always practice on Wednesday. We had family meals. Okay. I haven't done that in a while, because I'm working extra to try to help my coworkers. The influx of patients in the last, I would say, 6 weeks have been unbelievable. Now I blame our government, our state governor, because he relaxed the mask. He relaxed all the things that were working. And I don't know where this individual gets this information, but it was working. The numbers were stabilizing. Now we're zooming back up.
Thank you to Dorothy and Marissa. They're both nurses in Florida. Marissa mentioned at the end there that she blames the governor of Florida for the rise in cases. Well, Ron DeSantis signed an executive order in May that suspended all local COVID-19 emergency orders and related public health restrictions. DeSantis said during a news conference at the time, the fact is we are no longer in a state of emergency. And he said, I think that's the evidence-based thing to do. He added that asking vaccinated individuals to continue to wear masks would undermine confidence in the vaccines. He did at the time acknowledge that Florida was still not done with its fight against the coronavirus too, a story that we will continue to watch here on OS.